first of all, major depressive disorder, when a person is in a full-blown major depressive episode, meditation may or may not be the thing that's called for in that moment. We certainly don't have any evidence of that mindfulness or mindfulness-based cognitive therapy for depression necessarily is indicated for someone in the midst of a major depressive episode. Often this is a person who's very isolated, who has little energy, who's physically ill in some ways because they're not eating or sleeping. So I don't want to imply that mindfulness is sort of a cure-all for anyone at any stage of the disorder or the diagnosis. That having been said, someone may ask, well, why mindfulness? And why not just take the medication? Or why not just cognitive behavioral therapy or whatever? And my first response might be a little too flippant, which is that why is in your head. Okay, asking the question why, or why do I have depression, or why won't it go away, or anything else, is sort of an interesting exercise, and it's what researchers and psychologists and psychiatrists often muse about why does this disorder happen, and certainly that's important for understanding the mechanisms of it. On the other hand, asking the question why, beyond being an interesting intellectual exercise, probably doesn't lead very far to any sort of relief or any sort of different way of being in the world if you know why you're depressed. Because most of the time, we have enough trouble just being aware that we are depressed and what it's like to be depressed and tuning in fully to our own experience. That why has to do a lot with what was in the past, or has to do with a lot of intellectual exercise that isn't relevant to our direct experience. Our direct experience is that we feel a certain way if we are depressed. We feel a certain sensations in our body. We have a certain amount of energy. We have certain thoughts that pass through our minds. We have certain emotions that we feel. All of those things are our direct experience, and those are tough enough to deal with, much less trying to add in an explanation for why we have them. And that's true of literally every situation we're in. We can spend a lot of time wondering, why me? Why did I end up being this tall or having this color hair, or born into this family, or all sorts of interesting things that are just the reality of our situation, and consume a lot of our energy and don't do us a whole lot of good in terms of our quality of life. We're very much in the mode of wanting to fix whatever is wrong with us. And sometimes depression has a lot to do with struggling with the things that we see are wrong with us, and maybe even losing our perspective about how much is wrong with us, such that people are sometimes shocked when I'll look them in the eye when they come to see me. And I'm talking about people who meet criteria for major depressive disorder, or have chronic pain, or have cancer, or have to undergo a liver transplant, or any one of a number of other things, and I can look them right in the eye and say, you know what, I firmly believe that there's more right with you than wrong with you. And that's such an amazing concept, especially for someone who's struggling, for them to realize that that's true. That we do perhaps have fleeting or difficult feelings, or we may have physical problems or challenges, but we focus on them so closely that we lose track of the fact that there is way more right with us than wrong with us, that we have both strengths and weaknesses. It's just that we get so focused on the weaknesses, or so focused on trying to figure out what's wrong and fix what's wrong, that we don't even notice some of the other aspects of us. And this is not about being like Pollyannish or overly optimistic or saying everything's going to be okay or anything else, but just recognizing that we have everything we need. We have all the tools we need to be able to cope with the world. We sometimes can't access them, and sometimes we feel like there is no way to get to those things that we need, or we think we've lost the ability to cope. And really what this is about is slowing down, tuning in, paying attention, and recognizing that we have whatever we need within us. We have the ability to look at the world in a different way. We have the ability to choose whether or not we believe the thoughts that pop into our heads. We have the ability to choose to sort of reconnect with who we are as human beings. And I think that's ultimately the hugest most powerful thing that we do in teaching mindfulness.